Okay, I want to talk about the initial steps of taking a blood pressure. So we have our equipment gathered already. We have our patient. If she had just come in from the parking lot or something, it's a great idea if you can have your patient rest for about 5 minutes before you ever take the blood pressure. The other thing is they may be nervous about having their blood pressure taken. So you want to reassure them that, make small talk with them. Sometimes if you distract them a little bit, that'll allow them to calm down, because sometimes they're fearful of what the doctor is going to find if their blood pressure is too high or too low. So first, identify yourself. Hi, Mrs. Newroth. My name's Lynn Vandenbush. I'm going to be your medical assistant today, and I'm going to be taking your blood pressure, if that's all right. That'd be fine. Okay. So we're going to take her sleeve up if it's movable. Could you help me by pushing that up a little bit further? We need to have about 5 inches of free space. And then we're going to place our cuff. Again, watching where you're putting that artery marker. Making sure that it's about 1 to 2 inches above her elbow. And that it's snug. We don't want it real loose. And that her palm is up and her arm is comfortable. And then you're going to put your pieces in, okay? And then, start the process. Alright, today we're going to find the palpatory systolic pressure. This is like a precursor to doing the actual blood pressure reading. So I'm going to place the cuff 2 inches above her elbow on bare skin. Make sure that I've wrapped it pretty snugly. Make sure that my artery marker is pointing over the brachial artery. And then I'm going to feel with my 2 fingers over her radial pulse. Make sure I have that. Okay, I can feel that. So now I'm going to close my valve. Make sure that's shut down, and then I'm going to start pumping. I'm going to pump until I can no longer feel her pulse. I can still feel it. One more squeeze. Still feel it. I can no longer feel it. Okay, so that was around 160, so I'm going to go to about 190 and slowly release my valve here, and I'm feeling to see when the pulse returns. Okay, so it was about 144 where I felt the pulse. I'm going to slowly release it. So I know when I am taking her blood pressure for real, I'm going to go to about 174 with my pumping. Make sure I catch exactly when it starts for my systolic reading. Okay. So now I can remove the cuff. Ask your patient to do a little bit of exercising and raise their arm. Yeah, that's great. Okay, and then she can return it, let it rest for 30 to 60 seconds, and then I'll just go through the procedure again and putting the cuff on and then listening with my stethoscope to get the actual blood pressure. Okay, as a side note, after you've determined, how far you want to pump your blood pressure cuff up to and what that pulse was, you should have your patient raise their arm and do some little exercises to get some blood flow going again back in that arm, and then have them rest it down, palm up, rest for a few minutes before you actually take the blood pressure reading again. portion of the actual taking the blood pressure, checking it. So we've already determined how far we want to pump up our gauge when we did the pulse check and everything. So make sure that your little artery mark here is lined up directly over your brachial artery. And since I've determined the cutoff point was 120, I'm going to pump to 150 at least when I'm checking. So that's my guideline. So we're going to put our stethoscope in our ears. We're going to find that brachial pulse again. Place our stethoscope right over that brachial pulse. Make sure that we're ready to go, that we have that tightened. Then we're going to do the pumping, okay? And just squeeze the bulb. We're going to go to 150. Slowly, we're going to let our air out. Listen carefully. Then release the rest of the air slowly. Remove the blood pressure cuff. Okay, so when I was listening, when I pumped it to 150, then I listened for the first sound that I heard as I was releasing the air. Okay, I heard that at about 130. So I'm going to note that in my mind, 130. I have to remember that number. That's my systolic reading. Then I'm going to listen until I hear the sound go away. So if I hear that at 80, I'm going to make a mental note of that. That's my diastolic reading. So I just want to review with you, checking the blood pressure. The first thing we did was inflated the cuff to 30 millimeters of mercury above the original gauge reading that I determined on the previous video. We're going to open the bulb slowly, counterclockwise, so the air escapes at the rate of 2 to 3 millimeters of mercury per second. You must listen carefully and watch the gauge. So it's a combination of listening and watching the gauge at the same time. And the very first sound you hear again, that's going to be your top number, your systolic reading. You'll be recording that top number, so keep it in your mind. For example, 136 might be your top reading. The love dub sounds you hear are called Korsakoff sounds. So when you hear it go bump bump, continue slowly releasing air until the sound changes again and becomes very faint or stops altogether. And this is your diastolic or bottom reading. Last step, continue to slowly release the air for 10 to 20 millimeters of mercury after you heard the last sound. If there are no further sounds, rapidly let the air out of the cuff. If sounds continue, slowly release the air until 10 to 20 millimeters of mercury after the last sound is heard. Note the reading on the gauge. So if you keep hearing the pulse beating down to even to like 10 or 0, on some patients that will happen. You'll continue to hear the sounds. So then you add that extra recording, so where it actually stopped.